Okay, hi everyone. My name is Esther, and today I just decided to do a video that is going to explain to people here in Canada that the truth about HIV/AIDS. So, for the past week, for some reason, I've been having people come to my office. My tenants come there and they're talking about how that they're positive, HIV positive, and nobody else is there. Like everybody is treating them different because they're HIV positive. So today, I'm going to try to explain to people how they can catch HIV and how to avoid it. First and foremost, I want to tell everybody that HIV/AIDS, you cannot catch it through shaking hands with somebody. You cannot catch it through hugging someone. That's just a myth. You can only catch HIV through different reasons, and I'll show you what those reasons are. Right now, I just want to tell you that I'm not a medical doctor. I am not a medical practitioner in any way. I'm just somebody that has information about HIV/AIDS. I grew up in Uganda, and as you may know, Uganda is one of those countries that has suffered a lot with the HIV epidemic. So it's become, at one point they had to educate the masses about what's going on and the AIDS virus. So that's the reason I'm coming here to educate people in Canada, because I feel like most people do not have this information. And I feel like when I go to a doctor and ask them to do your blood work, they're all like, why are you doing blood work, and giving you all these questions and giving you all these stares. But the thing is, everybody needs to check their status every year to find out if as long as you have a sexual partner, you need to check yourself. You need to check every year to find out if you're HIV positive or not. The earlier you find out, the better for you. So there are myths about HIV/AIDS, and the reason why I'm very interested in this topic is because, as I said, most of my tenants came to me, and every time they come, they're talking to me about how they're traumatized, the way people are treating them, the stigma in Canada. Seriously, I didn't know how bad it was until for 1 week I received like 3-4 complaints about people that are treating others bad because the other party has HIV/AIDS. So in my mind, I was like, how can people be this cruel? Don't they have any information? Then I remembered when I was younger, when I was very, very young actually, our dad and our mom told us that there was a neighbor that had HIV/AIDS, and her name, I remember very well, was Night. And they told us to stay away from her, and they told us not to even go near her, because they expected that at that time in Uganda, everybody thought that if you did that, then you would catch HIV. So when we saw her, we basically ran away. We did not go near her, we did not touch her, we did not greet her, we just ran. And that used to happen for everybody in that neighborhood, and I can imagine what that lady went through at that time. And before we knew it, she was dead anyways. And in Uganda in general, HIV was so bad that the government introduced a system, and they started teaching HIV/AIDS in schools, how you catch it, how you can avoid it. And that's the information that I'm going to pass on to you, and I hope this video really helps to stop that stigma that is going out there for people that have HIV. There's one of my tenants was at my office, and she was explaining to me that she's being traumatized because of her neighbors. The neighbors know that she has HIV, and then they're on her, like they do not even talk to her because they think she's going to spread it all over the place. And some of them have actually been vocal with her and told her that, oh, you're going to spread your HIV everywhere. And that really pissed me off. I was like, really? How can people be so cruel? So one of my colleagues actually passed by and saw me hugging this girl, and she had had the previous conversation, and she was like, How can you hug her when you have HIV? When she has HIV, she just told you she has HIV. I told her, no, you cannot get HIV through hugs. You cannot catch HIV through hugs. You cannot catch HIV through handshakes. You cannot catch HIV because you're talking to somebody. It's not an airborne disease. It is a disease that is transmitted through certain fluids of the body, and that brings me to the point that I'm going to explain to you how you can catch HIV/AIDS. So first and foremost, HIV in itself is human immunodeficiency viruses, and it attacks the body's immune system. So when you have HIV, you may live with HIV for a long time and it will not manifest as AIDS if you take good care of yourself. If you don't, then it will manifest into AIDS and to cause a lot of other diseases, and to cause a lot of cancers, which will be hard to treat because your immune system is already compromised. So that's the first thing about HIV. AIDS is a progressive failure of those diseases to be treated. Like, you can get coughs, you can get diarrhea that cannot be treated well. If you take long without treating it, then your immune system is compromised, then it will affect you a lot. Some people get TB, some people get cancers that cannot be, like, you cannot treat them because already your immune system is compromised by HIV/AIDS. So that's the first thing. Now, coming to how you can catch HIV. HIV can be spread through sharing needles. If you share needles and syringes with people that are infected, you're going to catch HIV. Say, for instance, people that are on drugs, people that share needles when they're injecting themselves with drugs, those people are very, very at high risk of catching HIV/AIDS. The next group of people that catch AIDS is if you're sexually active, and HIV can spread through vaginal sex or vaginal sex and anal sex. So once you have vaginal sex and anal sex with somebody that is HIV positive, you may catch it. You are bound to catch HIV if you do that. The third thing that is not really common these days, but it happens, is through mother to child. So when a mother has HIV and the medical doctors or whoever is taking care of her does not know about it, so during childbirth, the child can catch HIV. So once you have HIV and you're pregnant, make sure you tell your practitioners and they'll take care of you and your baby, and they'll make sure that your baby is safe and safely delivered. Yeah, so I'll say another way that someone can catch HIV is by oral sex. So if you practice oral sex and you have wounds in your mouth, and the person ejaculates in your mouth or releases any fluids in your mouth, and like if you have wounds in your mouth, maybe you've been brushing, you brush a lot and you brushed that morning and you got a wound, or bleeding gums. If you have bleeding gums, stay away from oral sex with somebody that has HIV positive, because you'll surely catch it. Another way that I remember that people catch HIV is through blood transfusions. These days it's not common because people do they check the blood before it's actually transfused into people. So if the blood that they're giving you has HIV, was from an HIV person, it's very easy for you to catch it. So most practitioners make sure that the blood is checked before they can actually give it to somebody. Another way is by eating food that is actually pre-chewed by someone that has HIV. This is basically usually in infants. You know, like when you have a little baby and then you chew your food because the food is going to be maybe choke them, you're scared of food choking them, and then you chew the food and you're HIV positive, you could pass it to your child. So stay away from chewing food for babies, chewing food for anybody, because pre-chewed food can actually cause HIV if you have HIV. Another reason is if you're bitten by someone that has HIV. Say for instance, you're in a fight and then the person just bites you, and there's blood transfusions somewhere there, blood goes through her blood just, like once she bites you with her teeth, and if she has bleeding gums and all that, you can get HIV AIDS. Yeah, so another way is mostly, I would just want to say that HIV is mostly transferred from one person to another through blood, through semen, through seminal fluids, rectal fluids, vaginal fluids, or breast milk from one person to another if the person is infected with HIV. These fluids have to come in contact with your bloodstream for you to catch HIV, or they have to go, you can catch it through like a damaged tissue, or if you have wounds, then you will definitely catch HIV AIDS. So for today, I just want to stop there, and I just hope this information helps you. Whoever is out here to look for information, just know that when they say that you can catch HIV in air, or you can catch HIV through greeting someone or holding someone's hand or hugging them, that's a myth. It doesn't happen like that. And the best way to try and avoid catching HIV, if you're a very active sexual person, please wear a condom correctly. So if you must have sex, wear a condom. If you must go check your partner, ask your partner to go check. Don't go check them, but ask them to go and check their status, their HIV status. You yourself, you need to check your status every year to find out if you have HIV positive. So that stigma that is around, that people think that you're going to catch HIV through shaking people's hands and being in the same vicinity, please stop it, because it's very rude. It's very it's not humanly. So let's just love our friends, our neighbors, our relatives, whoever has HIV. If they have HIV AIDS, just love them, show them love, show them compassion, and you never know, they can even live 30-40 years, and if they take good care of themselves, you cannot even notice that they have HIV. So please, if you must, wear a condom. This goes especially for the youth in Canada, and for people that are sexually active. Please, if you must, wear a condom. And HIV AIDS cannot catch you through handshakes, through the air. It's not an airborne disease. It cannot catch you through shaking hands. It cannot catch you through hugging someone. Okay? All right. So I remain Esther, the Queen. Take care and bye.